So today we will talk about a procedure which is very commonly done. Many people are not aware about it, and it's called as otoplasty. This procedure is done for patients who have prominent ear. Their ears are coming in front, and they're very concerned about it. They don't like it. In some movies, it is shown. In some movies, it is shown that this prominent ear makes a person look like an alien. So, of course, the kids, the boys, the girls are concerned about it. So, if you know someone who are concerned about otoplasty or considering otoplasty or have prominent ear, watch this video because I'll be explaining you what this procedure is all about. Hi, I'm Dr. Rajat Gupta. I'm a board-certified plastic surgeon working in Delhi. And today we are talking about prominent ear correction. Prominent ear correction surgery is a daycare procedure. It's like an office procedure. A patient comes in the morning, get the surgery done, go back home absolutely at the same time after the surgery, maybe a couple of hours under observation after the surgery, and then they go back home. It's done under local anesthesia, so the patient is awake. They are not under sedation or under general anesthesia. We give a small needle prick on the back of the ear so that the area is made numb. Now, this surgery is done always from the back of the ear. The target is that the scar should never be visible. And what we basically do is stitch the ear back through to a scalp fascia. Now, it's called as a concho-mastoid sutures. So we suture the concha with the mastoid fascia, basically creating the ligaments which a normal person with a normal ear, normal position of ear has. So we create that fold, create that ligament so this ear is taken back. At the same time, some of these patients may also not have something called as antihelix. Now, the inside groove of the ear is called as an antihelix. The outside groove, outside fold is called as a helical rim. So some of these patients do not have antihelical rim as well, antihelical fold as well. So what we do something called as concoscapal sutures to create this antihelix shape. The target is the ear should not only move back, but they should have a natural or a normal looking shape. So there are two essential steps which these patients may need. One is concoscapal sutures to create antihelical fold, and then concho-mastoid sutures to stitch the ear back. Now, once these two steps are done, we close the incision by absorbable sutures so that you do not need any suture removal. And then we give a small dressing over the ear, or both the ears basically, for next 4 to 5 days so that the ear is supported. Once we have done the surgery, the ear do not swell too much. The gentle compression dressing helps us achieve that. Patient is up and about from the same day. The next day they can go to office, they can do work, they can do anything and everything. There's not too much of pain, just a tightness, kind of discomfort, and the patients are very happy. One surgery in which patient happiness is always there. It's a very rewarding surgery for both patient and doctor as you see this result immediately. And if you have any more questions about this surgery, please write it to us. Me and my team will be there to guide you scientifically. Take care. Bye-bye.